So hi everyone, welcome to you all in my another video. And today video is about nursing. So many of you always ask me that, so what is the process to migrate to Australia? So Jessim Joy with us, and she is last 15 years. She is helping to the nursing to immigrate to different countries, and now she is in Australia. So in Australia, you need to give an exam. So she is giving there's a ideologics, there's a she's basically give the coaching for that, so you can have, she's basically helping A to Z for nursing if you want to migrate to Australia. So we will see that Jason can give to all the questions about us. And so just can you give us a little bit about yourself?
Sure. Thank you, Dr. Akram, first of all, your time and, your valuable energy towards, and the initiative to bring in nursing to your channel.
Yeah.
So I really appreciate that. So I'm Jessin, everybody, and I'm professionally from India. I was a registered nurse, and then I did my bachelor's and master's in nursing in India, and then I did my master's in business administration, and had been working in the corporate sector from a very long time in India, before moving to Philippines for 4 years and then moving finally to Sydney, Australia. Okay. And I've seen nursing profession as, very closely. It is very close to my heart, and I've always been in the training space. As Dr. Akram said, from the very beginning of my career, I've always been involved with, upskilling nurses and then opening, opportunities for them, international opportunities for them to various different countries. And I feel that this is my calling. And previously I had worked with Max Healthcare Group in India, and had helped lots of nurses to move to South Africa. And then now I'm here in Australia. I've been helping nurses to move to Australia and get their nursing registration license here. And in the last 2 years, I've almost worked with more than 900 beautiful nurses across the world who have, started their journey towards nursing registration in Australia.
Wow, 900 nurses she already helped to immigrate to Australia. So Jason, can you tell us what is the requirement, what is the first requirement to migrate
Sure.
to Australia? Education requirement basically.
Absolutely. So Dr. Akram, on a blanket level, I would say that any nurse who's a bachelor's in science of nursing, who has done a bachelor's program, which should be around a 4-year degree program. Now that completely depends upon which country the nurse is. So that is why APRA, or Australian Health Practitioner Regulation Agency, who manages the nursing registration, has provided a system called self-check. And I will probably provide you the link of the self-check, and probably in the description you can give it to all the nurses watching this video. So because each country has their own qualification. So what APRA has done is that any nurse from XYZ country, she can go there and put in her qualification and immediately see whether she is eligible to move ahead in the registration procedure or not. So if I tell you, that if you look at the countries like India, Nepal, Philippines, so generally a person who has done their bachelor's in science of nursing, which is a 4-year degree program, is eligible to move towards the new assessment pathway for nursing registration. Somebody who has done, let's say, diploma in general nursing and midwifery, which is again a very common qualification in India, which is a 3.5-year program, is not eligible for the new assessment pathway called OPA. However, there are ways in which basically they have to upgrade their qualification via shorter programs, and then they can apply to Australian Health Practitioner Regulation Agency. Now this procedure is called self-check, which means that any person can go and put their qualification and check on them by themselves. Once they have done that self-check, if it's taking them to the payment gateway, which is the assessment fees that they have to pay now, and this payment gateway, they'll have to pay 640 Australian dollars, which is the assessment fees that they're giving to Australian Health Practitioner Regulation Agency. Okay. After the payment, they move to a step called orientation, which is a 1-hour learning module on APRA's LMS, which basically tells all the candidates about the role of nurses in Australia, how they work, what is the scope of practice, and it's basically to help them to understand Australian nursing practice in a better manner. Once they have completed that, they will move on to the documentation stage called the portfolio, wherein now they are required to submit all their identity as well as educational qualifications. And everything need to be submitted online, so they can do it from their home countries. And once the APRA gets the application and the documentation, they will go through them and they will approve them to the right pathway. So if it's a BSc nurse and the qualification is valid, they will move to the stream B category, wherein they are required to write 2 exams in Australia. So first exam is called NCLEX, which is a computerized examination conducted by Pearson VUE. Now this exam can be conducted, can be taken in more than 200 countries. So they can do it from their home. And then once they pass this exam, they have to appear in the second exam, which is called OSCE, Objective Structured Clinical Examination, which is a practical examination conducted in Adelaide, Australia. So for this exam, the second exam, they'll have to come to Australia and appear in this one-day examination in Adelaide. And then once they pass the second examination, OSCE, they are now eligible for registration. And at the time of registration, they are required to submit their IELTS, PT or OET certificate, along with criminal history check, as well as a good standing certificate. Now, a good standing certificate is nothing but a valid nursing certificate that, the state nursing council gives to the nurses, saying that, their license is still valid and they have to submit that to APRA, and hence the registration procedure is complete.
Can I just summarize? If you are just ready, मतलब आपने जो बैचलर डिग्री किया है, 4 साल की अगर आपने कोई भी डिग्री किया हुआ है, आप किसी भी कंट्री से हैं, तो यू एलिजिबल हैं आप ऑस्ट्रेलिया को आने के लिए। तो बेसिकली आपको एक सेल्फ चेक करना है, और कुछ से करते हैं उसका हमने लिंक भी दिया हुआ डिस्क्रिप्शन में, तो आप लोग उसको चेक कर सकते हैं। तो फिर उसके बाद क्या होगा, फिर आपको 650 का अराउंड में जो है फी पे करनी है। उसके बाद में एक एग्जाम होता है, वो होगा MCQ बेस्ड होगा, और वो आप अपनी कंट्री में दे सकते हैं ना। और उसके बाद एक सेकंड एग्जाम होता है OSCE। तो OSCE बेसिकली सेम सबके लिए होता है मेडिकल में, आप डॉक्टर हैं, डेंटिस्ट हैं, फार्मासिस्ट हैं या नर्सेस, सबके लिए बेसिकली आजकल हो रहा है यहाँ पे ऑस्ट्रेलिया में। तो वो क्लिनिकल एग्जाम बेस्ड होता है वो। तो उसके लिए आपको ऑस्ट्रेलिया में ही आना है, मगर जो एग्जाम 1 जो है, तो वो आप अपनी कंट्री में रह के ही दे सकते हैं। तो बेसिकली जो मेन जो हार्डल था, वो आप अपनी कंट्री में रह के दे सकते हैं। ये सेकंड वाला तो इतना वो नहीं है, वो आप यहाँ आके उसको दे सकते हैं। Just there's one question that if someone is coming for OSCE, so
Yes,
I mean, on which visa he has to come? I mean,
yeah, a very good question. So the borders are now open. So what happens is, once you have passed the NCLEX exam, you have to pay the fees for OSCE, which is $4,000.
okay.
Okay. Now, on this note, I'll also tell the NCLEX examination fees. NCLEX examination fees is $350 USD. And the OSCE examination fees, as I said, is 4,000 Australian dollars. So once APRA receives your 4,000 Australian dollars fees, they will be issuing you an OSCE eligibility letter. Okay. Now, in the eligibility letter, it's clearly mentioned that, for example, Justin has passed her NCLEX. She is now eligible to come and appear for the OSCE examination. And, that evidence is very important for nurses to supplement their visitor visa application. So generally, most of the nurses, tend to apply for a visitor visa, and, probably 3 months or 6 months, depending upon what their goal is. Are they going to come here and do the coaching, or are they going to prepare in their home country, depending upon each person. But majority of them would like to apply for a visitor visa. And since they have this evidence from APRA saying that, they have passed this exam and now they are required to come to Adelaide for this examination, it should not be a problem.
तो बेसिकली आपने जो एविडेंस जो आपने एग्जाम की तैयारी करनी है, so ideologists already given to you all A to Z the information. Basically you can pass easily. Justin will help in that examination. So after that, when you are applying for visa, so you have already have some evidence that you already cleared this exam. Now you are coming for OSCE exam, but definitely they will give it to you this the visitor visa. Visitor visa, basically they give you 1 year, but you have to be like 3 months maximum you can stay in Australia. So once you complete the OSCE, then you can further go. So visa you want to apply, and you can find a job, or maybe you can go back and later you can apply from your own home country. So Jason, what is the salary in Australia in general in nursing?
Yeah. So generally, on an average, I would say the starting salary is around $75,000 per year. It can range to 100K, 110K, depending upon, your seniority and how you're promoting yourself, like how you're getting promoted. But generally, on an average, a fresh nurse starts on a salary of $75,000 per year.
This is basically like a health manager. One government they fix is about 76,000 about, but it might be if you have experience, it might be a little bit higher, So it's not
Yes.
just that, and the saving, those one is up to you. Maybe if you are a single or maybe you have a small family, you can save it, good money in that. So another question is that the student mostly ask that, once they clear this exam 1 and 2, so they are eligible to apply for PR visa or they have to go for any work visa or something.
Again, depends upon each person. Some may would, some, the permanent residency is completely a different, topic, I would say, or, it's a different domain. And permanent residency, so many factors are there. Your age factor is there, your spouse's qualification, your qualification, your English score, your spouse's English score. So it depends upon, how many points you have, and you'll have to do, any nurse would have to do a lot of research on, applying for permanent residency. But many nurses initially opt for employer sponsorship because they start working in the hospital, they start developing that rapport with their administrators, and probably then figure out a way to apply permanent residency.
But I want to highlight here, if you want to say that which profession have highest demand in Australia. So number one, I can say is all the nurses, because in 17,000, the visa is reserved for the nurses in 2021, 2022. So this is the highest number visa they are given. If you are a like pharmacist, if you are a physiotherapist, or if you are any other profession. So highest demand for nursing. So nursing is not that much problem to getting a job or even in the PR, but PR based on your point. If you have high point, you will get very faster, So there are the visa, different kind of visa for PR. So you can, have a look yourself, or maybe you can discuss any of the migration agents. So it can help you more, So Jason, can you give us this NCLES exam? So how many exams, the questions they ask, and how many hours in this exam?
Sure. So the first exam, which is NCLEX, now this is an exam that has been going on in the world from a long time. It's not a new exam. It's a new exam in Australia, though.
Yeah.
So the NCLEX is basically an exam which is conducted in US, Canada, and now Australia, which means that a person who passes NCLEX can do the score transfer to any of these countries. There are certain conditions for it, but if in case a nurse, let's say, applies to Australia, and then in between, after passing her NCLEX, she wants to move to US and she did not complete her procedure with Australian Health Practitioner Regulation Agency, she can move her scores to a state board of nursing in US or Canada. So that's the beauty of this exam. This exam opens your, pathway or gate to 3 countries, basically.
Wow. So this is basically very advantages, if you are comparing like medical doctor, if you are, for example, you have to give a EMC exam, and US have the different procedure, UK have different procedure, Canada have different procedure, but in nursing, so you can, transfer your credential to US and Canada as well. Okay.
Right. So, and this exam is, as you said, Dr. Akram, you rightly mentioned, it's an MCQ exam, and the minimum number of questions is 75. It's a computer adaptive testing question examination. So it can range from 75 to 265, but right now, because of COVID, they had reduced the number of questions to 75 to 145, which means it depends upon each individual nurse, how they're performing. Either everybody will get definitely 75. Now, between 75 to 145 depends upon their performance and how they're moving ahead.
Okay. So how many hours are this examination? Yeah.
Sure. See, before the COVID adaptations, the examination used to, the maximum time allowed was 6 hours. But now, because of the COVID adaptation, they've reduced the number of questions. So it is now 5 hours. And it's highly recommended that, I'm sure that many people will watch this video later on. So it's highly recommended if you're an NCLEX aspirant and you're going to appear in the examination, please go and check on the NCSBN website and see whether, what is the number of questions and number of hours at that time, especially because, after some time, I'm sure that the COVID adaptations will be removed.
So this 5 or 6 hours, this is like continuously this exam, or like a part A or B? Is there any division?
No, it's a continuous examination. You can go for your, small breaks, like, but it's a continuous examination. It's a computer adaptive test, which means that the computer administers questions based on the person's responses. Yeah. And if they are, if they're continuously answering correctly the lower difficulty index questions, the computer administers higher difficulty index questions. So it's an adaptive test. So it does take, this much time.
Yeah, so this is basically is up to individual. If you are very good, and you are given most of the questions, the answer is good, the correctly, then it might be later on is they will like basic, then a little bit higher, and then higher, those kind of things. So just mostly the questions the student ask about this exam, but what kind of, I mean, they have confusion or something. If you can give a little bit about this examination, they ask. Basically, Jason is given, this ideologics, they give you
Yeah.
the coaching basically. So no
Yes.
need to worry. But I'm asking you, some frequently ask the questions, what the difficulty they face when they are sitting in this exam.
If I correct me if I'm wrong, Dr. Akram, are you asking the pass percentage?
Yes, I mean, I can say like कोई स्टूडेंट कोई ऐसा कोई डिफिकल्ट क्या क्या क्वेश्चन पूछते हैं इस एग्जाम के बारे में, क्या उनका कंफ्यूजन रहते
Okay.
हैं इस एग्जाम के बारे में?
Okay, yeah, I understand now. So basically, for everybody who's watching this video, you just need to go to the NCSBN who regulates this examination. If you go to the website, there will be you can easily download a test plan, which is like the curriculum for the examination.
Okay.
And as Dr. Akram mentioned, that we provide both the coaching for NCLEX as well as OSCE. And any good provider will only follow the NCSBN test plan because that is what they're going to ask. It's
Yes.
just like if you had done your grade 12 at that time, CBSE, whatever CBSE is telling you that in maths this is the curriculum and your examination will come from this, so it's the same way. So any nurse should go through the NCSBN test plan very, very diligently and prepare as per the test plan and the topics there.
So what is the English requirement to register with APRA?
Yeah, so the English requirement, they accept IELTS, PT, OET, and TOEFL. So the most common examinations are IELTS, PT, and OET. I mean, TOEFL, I haven't heard any nurse doing TOEFL, but I'm sure there must be some. But anyway, it's IELTS 7 for each of the modules, and you should also have an overall 7, of course. And for PT, it is 65 each, and for OET, it's level B.
So basically, if you want to register with APRA or you are any healthcare professional, you are doctor, nurse, pharmacist, this is for everyone is the same.
Yes.
So
yes,
yeah.
yes, it is the same. It is the same.
So is there any, how to get the first job where they are getting I mean, once they clear the exam, because you are a migrant, they are coming, they will face
Yes.
little bit some difficulty in initial days.
Right. No, absolutely. See, after you've got the registration, first of all, I would like to say I do not know any nurse who's unemployed.
Yes.
Okay. And I speak to more than 30 to 40 nurses every day. So every nurse gets a job. I mean, like, I don't know any nurse who's not getting a job. It's a different question that whether you like your job or you want to change that job. That's a different question. But everybody is able to, get a decent job. Some tips that I can, definitely suggest is that once you get your registration, be open in working in any kind of specialty. Like, many nurses ask us that, I have ICU experience, and do not be rigid. Whatever good option that you're getting, take it, grab it, and then slowly start getting experience, and then move to the specialty of your choice. Also, I would suggest that initially it may be a bit difficult for you to crack the interviews in a hospital setting, but preferably go, in that case, think of an option that you can work in aged care or residential care facilities. It's a bit more, lesser, the lesser competitive space, as well as also there are a lot of recruitment agencies. So you should try and get in touch with good recruitment agencies who may be able to help you and get you some casual shifts, some part-time shifts, so that, you start getting your experience firsthand. And then probably after getting some experience, then probably, it will be more easier for you to get into hospitals.
Another most important, she not mentioned, I'm going to mention here. Most of the migrants, they are migrating in Australia, so you might be not getting a job in a big city. So lot of jobs in Australia available for nurses, especially if you are ready to move for a regional area, definitely you can get a full-time job. Even the employer can sponsor your visa, so it is very easy for you to settle down as compared to like Sydney or Melbourne, a lot of cities in Australia and a lot of jobs for nursing. So I think for the jobs for nurses, there is no problem. So, Jason, what is the last at the end? What you want to give any advice to a student that are looking to migrate to Australia?
Sure. So from my experience, many of the students still have that notion that, you need to have IELTS, PT or OET score beforehand to apply to APRA. Let me once again clear this, that you do not need it at the application stage, you only need it at the registration stage after passing your OSCE. So my advice would be that, if you are a BSc nurse and Australia is the country that you have always dreamt of coming, then start your application procedure, and we are here to help you and guide you in the whole procedure. My team in Edulogics is an expert, in this domain, and we are here to help you in terms of your NCLEX preparation as well as OSCE preparation. We have also started visa services because there are many nurses who have completed their NCLEX and now coming to us, in the OSCE stage. So they ask us, they trust us. So they want that, we should be able to help them in terms of their visa as well. So we have started that as well. So in short, if you're a BSc nurse from India, Nepal or Philippines who have done the 4-year qualification, it's a perfect time to start your application. Don't worry about your IELTS PTE score, that's at the end. And basically, start with it.
Yeah, I mean, basically, अगर आपको माइग्रेशन करना है ऑस्ट्रेलिया में तो बहुत ही इजी है. आपने जस्ट डिग्री किया हुआ है, आपको एक्सपीरियंस ऑलरेडी, आप एलिजिबल हैं, तो आपको एग्जाम ऑनलाइन देना है इंडिया के अंदर. और बाकी जो काम है, वीजा जॉब, यहाँ बहुत ही इतना टफ नहीं है. लाइफ बहुत ही इजी है मुझे लगता है, स्पेशली नर्सेज के लिए, क्योंकि यहाँ बहुत ज्यादा वीजा अवेलेबल है नर्सेज के लिए, तो कोई इतना प्रॉब्लम वाली बात नहीं है. और अगर आपको कोई क्वेश्चन है तो प्लीज लीव द कमेंट बिलो, तो आई विल ट्राई टू रिप्लाई, एंड वी विल आल्सो हैव टू Jason for another video for the next time. If you have some questions, so leave a comment below. So, and Edulogics, I already given the link in the description, so if you want to go have a look, and you can chat with the team with Edulogics if you have any questions, so you can enroll in the program, and it will be easy for you, and yeah, thank you for watching this video. Thank you, Jason.
No problem, Dr. Akram. Before I wind up, I also would like to tell everybody that we have a small YouTube channel to help nurses, and probably Dr. Akram will leave the link in the description box below. And you can also, check out our videos. And if you have any questions, our contact numbers, emails, everything is provided there. And yeah, if you have any questions related to the nursing registration procedure, OBA, please leave them in the comment section. And of course, if, I would encourage you all to put in more questions, and we'll do a follow-up video soon.
Yeah, thank you.